Good morning, good afternoon, or good evening, depending on where are you attending this webinar on illicit use of veterinary drugs. Welcome all of you, and thanks for being with us with WVA today. The illicit use of xylazine presents a growing concern with important implications for public health and safety, and has gained public attention due to its misuse in non-veterinary settings. This webinar focuses on keeping available the veterinary use of xylazine as a sedative and analgesic agent in veterinary medicine, and trying to clarify the current situation of the vet use of xylazine and its illicit use. Our panel experts will discuss the current landscape, share insights, and deliver guidance on addressing this issue with a strategy for prevention. Veterinarians, healthcare professionals, law enforcement personnel, or concerned citizens are welcome to this webinar, which tries to provide you with valuable knowledge about the illicit use of xylazine, filling knowledge gaps, fostering collaboration, raising awareness, and equipping stakeholders with the necessary tools to combat the issue effectively. We hope to inform all of you about the veterinary clinical possibilities of the use of xylazine and to promote efforts to combat its misuse by people. I want to thank the speakers, Dr. Chen Hui Cheng, Dr. Lindsey Hornickel, and Dr. Kelly Ramsey. I want to thank also the WVA Secretariat and Grupo Asís EDRA. And last but not least, I want to thank to our moderator, Dr. Olatunji Nasir, a small animal practitioner from Lagos, Nigeria, that is chairman of the WVA Pharmaceutical Stewardship Working Group, WVA Council of International Regional Organizations, and president of the Commonwealth Veterinary Association. Dr. Nasir, thank you very much for the initiative to hold this webinar. Dear Olatunji, the floor is yours.
Thank you, Rafael, for that very brilliant introduction. I really thank you so very much. The imperatives of this webinar is to underscore the effects of the illicit use of drugs, and I mean veterinary drugs by humans. This phenomenon has reached an uncomfortable proportion to an extent that it needs the attention of every one of us. Veterinary drugs have always been discovered to be used by humans, especially the psychoactive drugs. First, it was ketamine, then fentanyl, and then a few unpopular ones. But lately, xylazine came into the picture and has gained a lot of prominence and notoriety among drug abusers. Its efficacy has driven its demand in the illegal drug supply chain, and coupled with the threats of scheduling the drugs, some manufacturers have resorted to counterfeiting it, eat it away from regulation, and it becomes so substandard what people are used to, and it is diverted into very illegal use by human abusers. And you can see from the video that a lot of people are using these drugs at the moment, and why they use it, it has caused them a lot of issues. You can see the necrotic skin, the fact that they are homeless, they don't go to work, and it's causing a lot of social issues. So it calls for concern, it calls for all hands to be on the deck to make sure that we try to eliminate or at least control the use of some of these drugs by humans, because it is not only damaging their health, it is causing psychosocial issues up to an extent of suicide, attempted suicide, and it is sure to destroy the society if not controlled. The video is showing a lot of these effects that you could see. Homelessness, like I said, threats to proper livelihood, and so many other things. So we will call for a concerted effort for this drug use to be controlled by all the global authorities concerned, with the kind of authorities that will make sure that this does not happen in our various society. Thank you everyone for joining us at this webinar once again. We are going to be talking about the illicit use of veterinary drugs by humans. And let me tell you what the meaning of illicit means. When you say illicit, it means drugs that are counterfeited, drugs that are unregistered, drugs that are substandard, and all of them having access to the drug supply chain and are diverted from their legal use. Normally, the drug we are talking about today, which is ketamine, is an animal drug. It is not a human drug, but it has found itself into the drug supply chain for humans because of certain use, which is extra label that this drug is being used for. And we say it's being used illicitly, and it is not just that, it's a global phenomenon, and it's a malady that has ruined countless lives and distorted the trajectory of many others with severe psychosocial issues. Next slide, please. When you look at it in a global sense, the problem is existentially global. But one thing that is so phenomenal is the fact that it has not affected the different regions of the world equally, according to the World Drug Report of 2009. In most countries, what has happened is that it has affected the poor, the very vulnerable, and the excluded, who are the ones who pay the highest price, especially in the global south, that is the southern hemisphere of the world. But in all countries of the world, whether poor or rich, the underdeveloped part of these places and the underserved communities are affected. So you see that poverty is a driving force in communities where this actually happened. So, and that is why in such communities, you see a lot of violence, a lot of insecurities are fueled by the unbridled access to some of these drugs. So it's so, I don't want to say annoying, but it's so concerning that the areas of the world that are being affected are the poor communities, in all parts of the country where you see drug abuse as being the order of the day. Next slide, please. So you want to say, what are the effects? What are the effects of this drug abuse? And in this case, I'm thinking about ketamine, xylazine, fentanyl, that are primarily animal drugs that are not being used by humans. Now, we have seen so many effects, which I'm going to highlight for you right now. And that is, it's causing a lot of human lives, and it's among the young population. We have a decimation of the young population in several affected communities. And that is not a good sign, because our future is being mortgaged already if we don't stop this. It's threatening the livelihood as the vulnerable skip work. They are less productive and they constitute a threat to the general well-being of society. It's causing a lot of psychosocial issues, including people attempting suicide, depression. And like I said, it's among the young population. And that is very concerning. It's limiting access and compelling scheduling of essential drugs like ketamine and xylazine, especially in the developing world. And in some parts of the developed world, I know that Ohio in the United States is already scheduling xylazine. And the catch is this, and which we must all understand. Society will not look, just like that, and will not want to control things happening to their people. So if an animal drug is going to cause issues in the human population, any wise government or any government at all will try as much as possible to see how they can control the access of that drug to the wider population. And that is the reason why a lot of governments are now drumming the world drums, so to say, trying to say they want to schedule xylazine or ketamine so that they will limit the access of some of these drugs to the human population. So, and another thing that could be of direct disadvantage to the veterinary world is the fact that if this is banned, I mean, in large animal and in some of the developing world where ketamine and xylazine are used for surgeries, the veterinarians will have a lot of issues because they will not have good access to this drug. And it can affect the conduct of veterinary business in some of these areas. Husbandry is another area where xylazine is largely used. I'm sure it's going to be very, very affected if xylazine or ketamine are scheduled. So, I mean, those are potential effects, and some of them are actually even being seen at the moment. They're no longer potential, but we need to make sure we do something in order to mitigate what effects this can cause. Next slide, please. This is just a slide to reiterate the fact that all regions are affected, but equal in impact. These occurrences reflect the differences in the drug market, in drug availability and legislation, as well as political, economic, and social conditions and nuances. Currently, I must say that only limited data exists on the prevalence of veterinary drug use in humans around the world, and the quality of the available data is even generally very poor. However, it is known that this problem actually exists because records have shown that its impacts in all parts of the world. There is no point saying that, oh, it's not in my region. It may not be in your region as for you to be able to recognize the effects now. But gradually, I think every region has it, and it depends on how it's impacting the different regions. Next. So why do we abuse xylazine? Or why are those abusing xylazine? Ordinarily, xylazine is used in veterinary medicine as a muscle relaxant and a sedative. And in horses, it offers some limited form of analgesia. And its use, especially in the developing world, is very phenomenon. For example, I would not contemplate a surgery in my part of the world without the actual use of xylazine. I will always use xylazine. And I'm sure in many parts of the world, it is also used like that. Basically, like we said, it's an animal drug not used in human medical practice. However, it is now used as an adulterant with recreational drugs such as fentanyl and heroin to intensify and prolong the euphoria induced by this drug. And let me explain. Fentanyl is a very effective opioid that is used by humans, but its effect is not long-lasting. But by the time xylazine is combined with fentanyl, the combination prolongs euphoria. Xylazine actually works to prolong the effect of fentanyl. And that is why the use of xylazine is very popular now. So it reduces the dose of fentanyl use, and then it increases the effect of fentanyl because it prolongs that effect, which ordinarily is short-acting. Well, what is the effect? It depends on the dose and the route of administration. That is the duration of the effect itself. Depends on the dose and the route of administration. And currently, there is no approved reversal drug for xylazine in most parts of the world. And that is why it is so concerning. It is so unfortunate because we cannot say, yes, we would have a reversal. A lot of people have advocated the fact that naloxone can actually do the magic, but naloxone is an opioid reversal for especially fentanyl, but because it is combined, people think it can also work for xylazine. So, but in the medical world, there's no something that is actually approved as a reversal for xylazine. Next slide. So how is xylazine sourced? There are a lot of speculation, but what we have understood is the fact that there are 4 basic sources for xylazine. There is evidence of diversion from veterinary channels because the xylazine that is made now is actually made for veterinary use. So you want to ask, why are other people getting xylazine? And I want to say very categorically that it could not have been from any other place other than from the veterinary channels for which it was intended initially that people are actually doing this. Number 2 is unregulated and unauthorized manufacturing in shadow markets because of the fact that they know it is a drug that commands good money. I think some manufacturers in the illicit trade have gone underground, and I think they are manufacturing this xylazine. I don't want to say in any specific part of the world, but that's why we call them shadow markets. And then there are also insinuations or some little evidence of theft from veterinary establishment. There have been cases whereby people have been convicted for stealing fentanyl, ketamine, xylazine from veterinary pharmacies in hospitals. So some of these are also very veritable areas where they also source the xylazine. And then smuggling, anything that you make not very available and it is commanding high price, also one way or the other will thrive in the smuggling world. So smuggling into most countries has also proven to be a veritable source of supply. And these are the 4 main sources being thrown about now as areas or as sources of illicit xylazine. I would want to stop at this time as we have our expert speakers who will speak on the use of xylazine in animals, the use of xylazine in humans, and the effect of the illegal use, and also the regulatory framework that is being enunciated in certain countries, especially in the US. So we are going to listen to those speakers very soon, maybe in the next few minutes. And I really want to thank you very much for listening. Thank you. Now I want to introduce the first speaker for this global seminar on the use of xylazine. So I have the pleasure to introduce Dr. Chen Hui Cheng. She's an associate professor from the Department of Companion Animal Medicine and Surgery of the Faculty of Veterinary Medicine, Universiti Putra, Malaysia, where she also graduated. Dr. Chen does lecturing, practicing anesthesia and analgesia, and participates in multidisciplinary research and collaborative works. Dr. Chen Hui Cheng, the floor is yours.
Thank you. Thank you very much, Dr. Olatunji. Very good morning, good afternoon, good evening to all my friends from around the world. It's very happy for me to be able to actually be at this webinar to share with you. In fact, actually like to take this opportunity to voice on the importance of having continuous access and the supply of xylazine for veterinary use. Let me first put on my slides to share with you. All right, okay. So, okay, I believe that for you who are the veterinarians, if you are working in this, you would have actually know this drug called xylazine. It is a alpha-2 adrenal receptor agonist. And just to go on the history a little bit, it is first synthesized in 1962 for the use as an antihypertensive drug in a human, but it was found to have a potent sedative effects in the animals. And then since then, as Dr. Olatunji have mentioned as well, it is really widely used in many species of animals, right from the smallest domestic animal in our practice, such as the mouse that we use in laboratory animals, and even to the large animals, such as the horses and even cattle. At least in Malaysia, I can speak actually that we are dependent on xylazine. And when we need to sedate the equine species for any minor surgical treatment, we would usually, at this point here, the supply of alpha-2 agonists that we have in the country that is brought in legally is xylazine. In other parts of the world, you may have drugs such as ditomidine to be used, or dexmedetomidine as well. However, in Malaysia at this point, and I believe in other countries as well, we are really depending on xylazine to sedate for minor procedures, or even to control pain in animal. And the other one is actually if we can combine with ketamine, and we can actually like anesthetize the horse for perhaps actually like castration procedure and so on. So it is still the basic ketamine xylazine regime that we are dependent on in this part of the world. And this is the same in small animals. It is really widely used for minor procedures such as wound debridement, cleaning, okay, and all that, as well as actually our routine spay and castration. Let me share with you, this is a simple brief survey from last year that I collected when I asked actually what are the typical anesthetic techniques that the private practitioners in Malaysia use. So we can see here from the survey, when we asked actually, like I listed actually the commonly used that I think of, such as ketamine xylazine, or the other one you can see that actually, you know, like top at 72.4% is the Zolatil ketamine xylazine, or perhaps some of you may have read from the journal. It's started off in the United States. Okay, Zolatil is the trade name of the combination we have here in this part. It is contain the tilatamine and the zolazepam, and combined with the ketamine and xylazine. So the so-called TKX mixture, it's widely used, as you can see here in Malaysia, as well as you can also see then the other injectable form is ketamine xylazine. So so based on this brief actually like a survey, we find that there is actually people in Malaysia, it's still depending on the ketamine xylazine based anesthetics to perform the most common neuter, okay, to control the population. All right. The other that you can see here is of course also the use of the Zolatil, okay, but still we only have actually like those who just rely on Zolatil alone may be limited, and they do combine with others, and xylazine do pop up in a few of their responses. Okay, here I would want to you know, like draw your attention here in terms of actually like an important consideration in private practice for sure, and you know, like why then, you know, like xylazine is actually really important. Cost can be something that is really in the top of mind when they actually you know, like offering affordable treatment for the community in here, especially in you know, like in the more suburban area or rural area, whereby in fact from the earlier slides we can see, I think we only have like 50% of the respondents that talk about having inhalant agents such as isoflurane. So the other half, you know, may not be able to afford and don't have the inhalant agent, because you need an anesthetic machine to be able to deliver the isoflurane. So we are depending on the injectable anesthetics. And for what we have, I just actually like draw out an example here on, using the ketamine xylazine base kind of combination compared to the other one that I can think of to be able to give, reliable and also steady anesthetic, such as the tilatamine zolazepam. And when we calculate the cost, and this is based on the costing I get from the, if we buy from our supplier, this year around August, and calculated the volume and all that. So we can see here, of course, this in ringgit Malaysia. So 2 ringgit and 26 if you're using that combination with ketamine xylazine. Where else, if actually like we buy on the Zolatil, you need to actually like pay for 14 ringgit and 94 cents. So that is actually like the cost that we're looking at, and that could actually make a big difference if we are going to actually like help with the mass neuter campaign to control the stray population. So that is actually like one of the points I want to put in, and to emphasize on the importance of having this supply of xylazine. So when I'm approached to actually like participate in this, so I thought that to actually try to gather some quick survey from friends that is actually around the region here. So this is just a quick survey that I did about 3 weeks ago, and it's actually based on just like creating a Google form, and I'll forward to my veterinary colleagues, and they then continue to forward to their contacts and from different places, covering from Afghanistan, India, Pakistan, a few more, which is a few one from the Indonesia, the Philippines, as well as Thailand. So, and they are actually like practicing veterinary practice, majority, about 65% of them in small animal. They also have representative from others practice, as you can see here, like from the equine, ruminant, lab animals, and so on. So one of the questions I'm interested to know is actually to find out like whether xylazine is available. So here we can actually like see out of the respondent, that's more than 80% say that it's available. Some who may not have actually used it, they are not sure. And then the other preparation, which is the higher concentration, one such as the 100 milligram, less than 50% are really sure that it's available in your country. So from here, we can see that then actually like there is a difference in actually like availability or even the different preparations of xylazine to their country. One of the other question then I asked is whether they consider xylazine as an essential drug for their practice. And we can have more than 90% that consider it is an essential. So some of them that actually like do not consider essential. I did not actually like go through to ask further, but when I asked other questions such as what is it that they would use to anesthetize their patients. So mainly these are from actually the small animal. We would see that they would have other options that is available to them. And usually they have actually the anesthetic machine with them. So therefore, they will not be reliable on the injectable anesthetic. And this actually like the respondents from this, it's in Malaysia as well. Also from the India as well. Okay. I mean like a respondent that may come from the rural area in India and Pakistan, majority of them really says that they rely on xylazine. This is actually like the last part that actually I asked, since like with the title of this webinar, and that give them the like concerns, like whether we would have actually like face any disruption in supply if, let's say, xylazine need to be actually like we don't know how tight xylazine will be actually like in control. So I just choose a few of these concerns and raise it. For example, one respondent to say xylazine, they're able to restrain animals, all these different species. So according to him, it's very safe with minimal side effects. And without this drug, it's very difficult to perform minor procedures. And another one say that it will impact animal care, as the sedation is necessary in wild animals for close examination and treatment. And other sedatives like vancomycin, ditomidine are not available in Pakistan, and they are very expensive. And it will definitely increase the cost for small animal practice and seriously limit the options for large animal medicine as well. Very difficult to get the treatment in the countryside. And some just say we don't have other options as other anesthesia is not available. So I hope with just this simple presentation and some of these examples, I'm able to actually like drive the message to say that xylazine is essential in veterinary practice. It is a cost-effective sedative and to be used also as a core anesthetic drug to provide short procedures, at least in small animal, to actually like enable us to carry our spay and neuter, and which is very important to control the stray animal population. So therefore, we do need to actually like see how we can go about to ensure that we have the continuous supply and availability of xylazine for animal welfare, animal care. So with that, I thank you for your attention. Thank you. I pass it back to you, Dr. Olatunji.
Yes, thank you, Dr. Chen Hui Cheng. And we have heard about the use of xylazine in our animal species. Before I introduce our next speaker, we want to enjoin the audience to go to the question and chat section. If you have any question, please leave your question at this time. And if you have any comment, also leave your comments at this time so that the speakers will be able to tackle this after their presentation. And one of the most important things that I heard from Dr. Chen is the fact that during our survey, she was asking whether xylazine is easily available in your country. And that's a question I want to pose to everyone. Is xylazine easily available in your country? And peradventure, xylazine's access is controlled by scheduling. Do you think your veterinary practices will also be affected? So that is just by way of my observation. Now we have with us another speaker, Dr. Lindsey Hornickel, who is the Assistant Director of Government Relations Division at the American Veterinary Medical Association. With a career spanning over 9 years, Dr. Hornickel's journey began in rural mixed animal practice and extended to urban small animal practice. Passionate about promoting evidence-based information and research, Dr. Hornickel actively represents veterinarians through the Washington State Veterinary Medical Association. I have the honor and privilege to bring in Lindsey to deliver our paper.
Wonderful. Thank you so much for the opportunity today. So I am going to share my screen now. So hopefully you can see that. Looks like that's working. So wonderful. And thank you again for the opportunity. And I think Dr. Cheng did a fabulous job framing why this drug is very important to veterinarians around the world. And so as we face these challenges in what was laid out in the beginning for the illicit market and what we're seeing and its importance, how do we bridge that gap? And that's where we start to work with policymakers in that. And so I'll be sharing with you the challenges and strategies we've experienced to date in the US as an organization. And this is a real-time experience, and this is still happening. And so these are our observations and the experience so far. And again, it's ongoing, so yet to be determined. But what we'll cover today is we will go through kind of just a brief regulatory background of how it's handled in the US, what our experience to date has been in 2023 in the policy space, and then again, more specifically, what our perspectives are as we start to address xylazine at the policy level, where we're at, and give you an update in real time and what solutions have been put out there, and then what we've learned along the way. So in a short 15 minutes, we'll cover all that. But I want to start out by framing this with the veterinarian's oath. So this is the US version that's been adopted by the American Veterinary Medical Association, but there are similar oaths taken by veterinarians around the world in terms of what our mission and our task is in the profession. And it is often include the protection of animal health and welfare, but it also often in many countries, including the US, includes the promotion of public health. And so this is a recognizable public health issue for what's being seen. And so we really want to be helpful and support all the members of the public health community as this issue is being addressed, while we're maintaining and preserving access to this really critical drug in the veterinary space as well. So I wanted to make sure to frame that, because I often will share this when I'm speaking in any space about this issue. So again, just to provide you the background and how xylazine in the US is handled, it is a FDA, a Food and Drug Administration approved prescription drug since 1972. And what that means is that it can only be used by or under the order of a US licensed veterinarian and can only be dispensed in the course of their professional practice. There's also state laws that are used in conjunction with those federal laws that require all prescription drugs be distributed only those who are legally entitled to obtain and possess them. And veterinarians are required through these laws to maintain medical records as well. Of additional note, manufacturers and distributors also have established internal compliance systems to ensure that they are only providing products to those legally entitled. So again, just giving you the framework of how this is handled. But I also want to just give you the framework of US scheduling and controlling of drugs in the US, so that because this is often brought as a tool and how this would be potentially addressed, the illicit drug supply. So currently, xylazine is not a scheduled drug in the US, but again, this is discussed often as a tool. So the Drug Enforcement Administration is primarily responsible for implementing and enforcing the Controlled Substances Act, which establishes the regulatory framework for the drugs that are deemed to be of risk for abuse or dependence. So the designation where they fall on the scale from 1 to 5 is based on the medical utility and the potential for abuse and dependence. And what that schedule also determines is the level of restriction on the production and distribution of this, as well as the penalties applied for improper handling. And then of note also is, how do the drugs end up on the scheduling list? And it can be done in one of 4 ways in the US. So legislatively, so Congress can place a substance under a control by statute. It can be done administratively, so the DEA can designate a substance to be controlled through rulemaking. There's also a emergency scheduling, which is done by the DEA, where a imminent hazard for public safety is put on a Schedule 1 schedule as in a temporary status. And then there's also international treaty obligations that may deem where a substance will end up on the scheduled list. So again, just to give you, I won't go into this in detail, but just to provide you kind of the scale and scope of what this experience has been for our organization over the past year. Starting and understanding kind of the framework, our first call from Capitol Hill came in January of this year. And pretty quickly after that, several different offices were calling us for members of Congress. And the first questions we were facing were, we have legislation that we're interested in introducing that would schedule xylazine as a Schedule 1 drug with 90-day implementation. Is that a problem? And is clearly you can see from the restrictions that would be applied, and Schedule 1 being the most restrictive and not having medical purpose, yes, that would be a major problem. And so we had to work really quickly in order to start educating, disseminating information, and working with all of these offices. And we were able to do that with a lot of outreach from allied members and other stakeholders. And it culminated into a bipartisan bill that was introduced in the House and Senate in March end of March. So that was pretty quick turnaround from that. But I also put in here other markers for agency intervention. So the Food and Drug Administration also issued an export alert at the end of February, and the White House designated xylazine mixed with fentanyl as an emerging threat in April as well, which was the first time A law that was put in place in 2018 had been used to make this declaration. And so, again, multiple arms of government are involved here, Congress, White House, agencies, and it all kind of keeps moving forward. And we're doing outreach in all of those spaces. So again, size and scale, things at the federal level don't often move this quickly. And so it really took a lot of organization and outreach that we'll kind of go through here and just in sharing our experience. So it continues to move forward. There was additional legislation that was put forward in July and September, and we're still actively working with offices on all of that. So there we go. So in our outreach and our education, we have found that we've really narrowed on and in on several important aspects of this from the veterinary perspective. So xylazine is unique in several ways. It is, first of all, it is dispensed to keep people and animals safe. And when we look at the Controlled Substances Act in that framework for scheduling, most of our veterinary drugs will work within that structure, but not all. And xylazine is one of those. When we talk about dispensing it, it is dispensed for urgent and emergent use in some cases. And as Dr. Cheng had covered, it is used in some routine procedures, but it's also used in urgent procedures. And so at the time of dispensing for a veterinarian, you don't always know what animal that's going to be going into. And so that does not work under the definitions of the Controlled Substances Act. And so it became apparent very early on. It doesn't create that closed loop system. And so in those spaces where it's needed really urgently, it's the processing plants in order to be in accordance with the USDA humane handling guidelines. There's livestock producers that will keep doses on hand to be able to handle and address injuries or assist with birthing and other things. It's also used by animal control and law enforcement officers, wildlife, and research. So again, in these spaces, it becomes a problem very quickly if we just quickly say, well, why don't we just schedule it? That's one issue. There's also the fragile marketplace. So this, again, is it's a low volume, low margin generic drug. It's been on the market for a long time. And so currently in the US, we only have one manufacturer for the FDA approved product. We potentially will have two, but currently we only have one. And part of that has been because of the state patchwork rulemaking that's been happening. And so manufacturers are hesitant to keep putting this out and accidentally be not in compliance with many of the different regulations that are out there. So we are very much trying to find a federal solution to create predictability and uniformity, not only for the manufacturers and distributors, but also for our veterinarians. It's also important when we think about fragile marketplace, the more restrictions and regulatory burdens on investment in those facilities and how that drug is handled also threatens it in the marketplace. Asking some of these manufacturers to handle it in a way that is far and above the investment cost that makes sense for making a drug that is a very low margin drug for them is very challenging. And so it's also really important that that's taken into account. There's also really critical uses. So again, as was mentioned, in some animals, there is no practical alternative. And so it's also used in sedation protocols and research. And so if we were without the FDA approved product, very quickly, this would cause a lot of complications in many different spaces. Also, the utility and the fact that it's reversible in veterinary species, we have reversal agents, is also a really critical component when you're talking about wildlife species, zoo and large animals. You can have secondary injuries from prolonged sedation with bloat or tissue damage. And also, when you're talking about wildlife, return to the herd and self-defense is really important. So the utility of being able to reverse this drug is makes it a critical tool as well. So again, I just cover those because those are kind of the really important points we like to hit home on when we're talking to policymakers about why this drug is unique. And so these are incorporated, and I'm kind of going to look at these across in pairs. So as we look at those challenges, what are our strategies that we look at in policy to try to address them? And again, this is very veterinary focused, but we try and kind of look at the veterinary side so that We know how to address it so that, again, our public health partners in law enforcement, however they need to handle it, they know what we need from this conversation. So again, the Controlled Substances Act does not work for xylazine and how it's utilized in veterinary medicine. And so we have looked, there are some policy precedents. This has been looked at before. The Anabolic Steroid Control Act of 1990 was a situation that we feel was very similar. And in that case, they actually excluded the FDA approved drug from scheduling in that case. So how do we look at previous policy to try and inform what we're doing today? Also, if you look at when ketamine was scheduled, that was a situation in which there were really specific transition times that made sure that it didn't cause supply chain disruptions and that it was workable for the inventories that were out there. So those are things that we look at and we are working through and talking with offices on. Again, the supply chain being very fragile and the burden of investment for this is a concern. So is there opportunities to adjust what the retrofitting requirements would be for manufacturers or distributors? And those are things that we're exploring. It's also important to note that veterinarians are not the substantial source of illicit xylazine in the US. And I think that's experienced in many parts of the world as well. And so that being the case, I think us asking for an exemption for the legitimate veterinary project from scheduling is a valid one when veterinarians are not the substantial source of this. Also, it has been very clear from our administration that scheduling of xylazine is likely going to happen if it's not done legislatively. So at this point, we are really focused on trying to do a bipartisan focus on the legislative side and find larger legislative packages to increase the likelihood of success in this going forward. Because we see an opportunity to create what we need in veterinary medicine legislatively in a more tailored manner than we would necessarily if it was done administratively. Another challenge is just the scale and time frame for outreach and education necessary. Our approach to that has been incredible partnership in our state veterinary medical associations. We've had grassroots advocacy done with all of our members, and our allied groups and stakeholders have done an excellent job of assisting in doing that outreach and education as we move across this. And of course, when we're working in policy, there's always some level of politics involved with this. So how do we navigate that? And we are really dedicated to working in a nonpartisan manner and really working with all of those offices that want to work with us. So that's been our experience to date in terms of what we've seen and how we've tried to address them. So where we're at right now on the federal side, again, our ask for this is for timely passage of a federal solution that has a veterinary exemption, or at least takes into consideration the needs of veterinarians. There are several versions of language that are moving through Congress right now, and fortunately, all of them currently include considerations for its use in veterinary medicine. And there has been ongoing engagement from the federal agencies in our work on the legislative side of things. So we find that, promising at this point, but again, this is still a really fluid situation and we are uncertain of what that outcome looks like right now. There's also the emerging threat designation that I talked about in the beginning from the White House. We are waiting for the implementation plan that was actually due out in August and has yet to be released. So that could also change the landscape of things as well. As I mentioned, on the state side, there has been individual states across the US that have also seen what's happening and want to step in and address this. So our ask when it's been individual states, if the state association is looking to us for assistance in that, our asks are typically to suspend or postpone xylazine rulemaking and wait for the federal solution to come through. If they are planning to move ahead regardless, then asking again for that veterinary exemption and its product and use from any scheduling or any other intervention that is taken. To date, 20 states have considered the status of xylazine, and 8 have enacted restrictions. So again, that is very challenging for us in the supply side of things. Manufacturers, again, are nervous about what that looks like when you have 8 different states and 20 other states considering things. So let me go. So just in closing, so the things that we to date have worked in getting us to where we're at is really early in stakeholder engagement and collaboration. And it was also really important for us to be able to hit the ground running is really building relationships with policymakers and agencies, have that network and your stakeholder groups, so that we could start those conversations with an existing relationship, and we weren't, building the plane and flying it, as much as we in those relationships, they were existing. The problem was new and we were figuring that out, but the relationships were solid. So that was helpful. Again, utilizing existing precedent when possible. There isn't a one size fits all, but taking those pieces and adding them in can be very helpful. And working really consistently and collaboratively with not only your allied groups and stakeholders, but with those policymakers. And then doing that outreach was really key in this situation. Going through the unique uses and circumstances of xylazine was really helpful in many of these offices because, again, we use other controlled drugs. And so there's an assumption that because we use controlled drugs that this will work in this situation, and that's not always the case. So that is it for me. And I know we will come back to questions in the Q&A. Thank you.
Our next speaker is Kelly Ramsey. Dr. Kelly Ramsey is part of the American Society of Addiction Medicine and an internal medicine physician who has treated substance use disorder since 2004. Dr. Ramsey has provided expert advice to the New York State Department of Health AIDS Institute and was the recipient of the New York State Commissioner's Special Recognition Award for contribution to drug user health in New York State in December 2018. Dr. Kelly Ramsey, the floor is yours.
Thank you so much to the WVA for having me today. So I am the non-veterinarian in the group. I am the one who is going to be talking about human effects from xylazine use. So I've been asked to focus on health risks and concerns and exploring potential dangers associated with illicit xylazine use in humans. So here are the topics I'm going to very quickly cover in the 15 minutes we have together. I'm going to do a very brief overview of the epidemiology and ethnographic research regarding xylazine use in humans, discuss xylazine's contribution to overdoses in the United States, discuss toxicology testing and drug checking strategies for xylazine, discuss clinical effects of xylazine use in humans, and finally discuss nascent management strategies for xylazine-involved overdoses, xylazine wounds, xylazine use, and xylazine withdrawal. So this is a very busy slide, but again, I wanted to be thorough in the brief time that we have. So initially, xylazine emerged sporadically in the literature back in the 1980s and 1990s as a substance of misuse. However, first widespread misuse was reported from Puerto Rico in the early 2000s, where it was known as anesthesia de caballo, or horse anesthesia. Xylazine appears to be diverted from veterinary sources, so it is not manufactured illicitly. So it's very different from fentanyl and other highly potent synthetic opioids that are all manufactured illicitly. Misuse stateside first was noted in Philadelphia in 2006. So from ethnographic research, which was primarily done in Philadelphia and in Puerto Rico in the early to mid early 2000s and then mid teens, so in the 2011 to 2013 period. So xylazine was not confined to a limited area geographically in Puerto Rico. It was found to be highly prevalent in use syringes collected in cattle farming towns, which makes sense given its diversion from veterinary sources. So it was found between 91 to 100% of collected syringes in cattle farming towns. Prevalence of xylazine use in the greater San Juan region of Puerto Rico was as high as 80.7%. And of those using xylazine, what they noted were a high incidence of skin lesions, a high incidence of overdoses, and a high incidence of increased injection use associated with xylazine. They also found that over 90% of used syringes that contain xylazine also contain heroin and cocaine. So a little more information. So xylazine is just one of many in a progression over time of additional substances showing up in the unregulated drug supply. So again, what used to be heroin no longer exists anymore pretty much in the US, and now it's primarily fentanyl combined with xylazine in many regions of the United States. So over the last decade, again, we've seen an increasing number of novel psychoactive substances emerging in the historical heroin supply in parts of the US and Canada. So Philadelphia, again, being the hotspot for xylazine, in Q3 of 2022, 91% of what was being sold as dope or heroin actually contained fentanyl and xylazine. In quarters 1 and 2 of 2023, again in Philadelphia, the average amount of fentanyl in dope, again, historical heroin samples, remained mostly consistent, while the average amount of xylazine increased 34%. On the right-hand side on the top, you can see the number of increases in xylazine showing up in seized samples of street drugs in Philadelphia. So you can see that marked increase over time. On the bottom is showing in the Canadian drug supplies samples of xylazine and the co-occurrence of it with fentanyl, which is where its strongest ecological link is, but then other substances added to the fentanyl and xylazine, such as non-medical benzodiazepines or synthetically manufactured benzodiazepines. So on this slide, I'm showing that we actually know now that the geographical spread of xylazine is far more extensive than was originally thought. So a study that I have the summary of on the left-hand side was actually done in primary care settings in 39 states in the United States between April 2021 and March of 2022, looking at how common that xylazine was showing up in urine toxicology samples. So again, it turned out to be a low percentage, but it was widespread geographically. So even back at that time period, it was found in 25 of the 39 states. So again, highly under-recognized in most geographical settings. On the right-hand side on the top is showing DEA data. So this is from seizures, again, of street drug supply, and the increase in that percentage between 2020 and 2021. So you can see in all regions of the United States, whether it's the Northeast, the South, the Midwest, or the West, you're seeing an increase in the presence of xylazine. On the bottom is looking at xylazine detection and fentanyl positive urine toxicologies, again, by region of the country. You can see that the primary area of concentration is in the mid-Atlantic states. However, it is found in most states in the country. What about xylazine's contribution to overdose deaths in the United States? So from another ethnographic article, from 2015 to 2020, the percentage of all drug overdose deaths involving xylazine increased from 2 to 26% in Pennsylvania, 19% of all drug overdose deaths in Maryland in 2021, and 10% of drug overdose deaths in Connecticut in 2020. From New York City, we had released in December of 2022, that 19% of opioid-involved overdose deaths also involved xylazine. Now, because xylazine is present doesn't mean that it was the cause of the deaths. These deaths were primarily caused by fentanyl and other highly potent synthetic opioids, but it is notable the increase in the presence of xylazine. On the right-hand side, again, is showing some of that data. On the top, showing the geographic distribution of xylazine positivity and overdose deaths. With the red coloring is showing the most prevalent regions. And then on the bottom is showing the number of xylazine positive overdose deaths by region, again, from DEA information. And you can see that it pretty much varies depending on the geographical region that you're in. From the Morbidity and Mortality Weekly Report out of the CDC from June 30th of 2023, The percentage of illicitly manufactured fentanyl-involved deaths with xylazine detected increased 276% from January 2019 to June of 2022. So xylazine was detected in less than 12% of illicitly manufactured fentanyl-related deaths overall, but varied depending on the jurisdiction. So the highest being 27.7% in the Northeast, and then other regions of the country, 0%. And again, some graphics from that article are on the right-hand side. So moving into xylazine toxicology testing and drug checking strategies for people who use drugs. So with respect to toxicology testing, there are not commercially available point-of-care tests or hospital settings that have immunoassays, urine immunoassays. It's not routinely tested for in clinical settings or even post-mortem in overdose cases in most jurisdictions. There are more sophisticated analytical techniques that can be used in a laboratory to detect xylazine in either urine or serum, but again, these are a little bit of a long turnaround time to give you actual clinical information on the ground. So there are drug checking strategies. So similar to fentanyl test strips, there are xylazine test strips. They have been available commercially in the United States since April of 2023 and have been validated for detecting xylazine in drug samples. So one particular brand, BTNX xylazine test strips, were validated with high sensitivity, 100%, high specificity, 85%, and high precision of 91%. So xylazine test strips, like fentanyl test strips, give you a qualitative answer of yes or no if xylazine is present in the drug sample. In the field, there are also some quantitative drug checking technologies, including by FTIR, which can actually tell you the quantitative amount of xylazine present in the drug supply. That gives you then an opportunity to do harm reduction education and risk mitigation strategies with individuals who intend to use that drug sample. So moving on to discussing clinical effects of xylazine use in humans, and I've broken this down into 3 different categories. So first is profound sedation or unconsciousness for extensive periods of time. Now, why might this be problematic for a person who is using the substance? It makes them very vulnerable to sexual assault, physical assault, and robbery, but also there are potential medical complications such as rhabdomyolysis, deep vein thromboses, compartment syndrome, or fatal or non-fatal overdose. So obviously, xylazine is not an opioid, though again, there's that strong ecological link with fentanyl. So always important to respond to an overdose with naloxone. But if 2 doses of naloxone are not making a difference and you're not getting the anticipated response of a normalization of breathing, then you have to support airway and breathing and circulation in individuals who may be under the influence of xylazine. Not only is it not an opioid, but the muscle relaxant property of xylazine causes the tongue to actually block the airway. So you need to maneuver the individual so that you move that tongue out of the way or use something like an oral airway to make sure that the air can actually be breathed in by the individual. Next is xylazine physiological dependence and withdrawal syndrome. So unfortunately, it's not a well-characterized use disorder yet, nor are there evidence-based options yet for treatment. There's also not yet well categorized the withdrawal syndrome. The primary symptom is anxiety. The duration of symptoms typically lasts several days to several weeks, but they may be protracted. And unfortunately, xylazine withdrawal syndrome is often conflated with opioid withdrawal syndrome. So it actually precipitates opioid withdrawal syndrome. So if someone were being initiated onto buprenorphine, for instance, for the treatment of opioid use disorder, they might be initiated too soon based on the xylazine withdrawal symptoms, and that could cause precipitated opioid withdrawal in that individual. There's also xylazine-associated skin injuries. We do not yet know the pathophysiological mechanism which causes these skin injuries. These can occur at injection sites, but also at skin sites that are not associated with injection and in individuals who don't inject. It's really important that individuals receive early wound management to prevent these from progressing into necrotic wounds like the one that's shown in the picture at the top, which require more complex wound management. So I'm going to talk about some nascent management strategies for a variety of complications associated with xylazine use. So first, some nascent management strategies for xylazine-involved overdoses. So as I mentioned, there is that very strong ecological link between illicitly manufactured fentanyl and xylazine. So always give naloxone in a suspected overdose as the initial response. So give 1 dose of naloxone, activate emergency medical services, wait 2 to 5 minutes, let naloxone take effect, and then give a second dose of naloxone. If breathing has not normalized, then reassess and address airway, breathing, and circulation, and suspect additional substance involvement, whether that's with xylazine or synthetic benzodiazepines, et cetera. The individual should be put in the recovery position, give rescue breaths, and support breathing with other tools if those are available, such as a pulse oximeter, a bag valve mask, oxygen administration, or insertion of an oral airway, or any other maneuvers that you are trained to do, and do CPR as needed. So some nascent management strategies for xylazine-associated skin injuries. So first, evaluate for local and systemic infection. These are not infectious wounds, but obviously can become super infected with bacteria. And then treat appropriately with antibiotics. Cleanse the wound with non-drying agents, moisturize the wound as needed, cover and wrap the wound. For complex wounds, moisturize and medicate the wound bed with medical grade honey on the eschar and antibiotic ointment on the slough, and mechanically debride as needed and triage to a higher level of care as needed. On the top, it has a wound at what it looks like at very early onset, which looks very similar to other wounds, such as injection-related wounds. On the right-hand side is an unfortunate, very late presentation of a xylazine skin injury, which at that point you can see has a lot of necrotic tissue. On the bottom are an ideal list of supplies to have to respond to xylazine wounds. So now some nascent management strategies for xylazine use and withdrawal. So as mentioned, there's no well-defined or well-characterized xylazine use disorder. There are no FDA-approved medications for the treatment of xylazine use disorder. There are only case reports on treating individuals with xylazine use disorder for acute withdrawal and protracted withdrawal symptoms with medications such as clonidine and gabapentin. And it is not yet known if individuals with xylazine use disorder would benefit from long-term medication use, such as buprenorphine or methadone for opioid use disorder. With respect to xylazine withdrawal management, unless contraindicated, individuals with acute xylazine withdrawal should be treated with clonidine or another alpha-2 adrenergic agonist. For individuals with concomitant opioid withdrawal syndrome and pain, a gabapentinoid or ketamine may also be considered. And then adjunctive treatment for restlessness and or agitation could include antipsychotics, benzodiazepines, or antihistamines. So some conclusions to wrap up this section. Xylazine's prevalence is likely underreported both in its geographic distribution and in its contribution to overdose deaths. Polysubstance use overdoses are under-recognized, and unfortunately, naloxone alone has often been the default response without supporting airway, breathing, and circulation. Toxicology testing for xylazine is not routinized. Xylazine test strips and in-the-field drug checking are means to identify xylazine in drug samples, so people who use drugs can make more informed choices. Clinical effects of xylazine use in humans can be significant and include xylazine-associated skin injuries, unintentional overdose, profound sedation or unconsciousness, physiological dependence to xylazine, and xylazine withdrawal. And limited research on xylazine in humans means that defining xylazine use disorder, the physiological effects of xylazine with both chronic and acute use, as well as appropriate treatments for xylazine withdrawal, are not yet well established. Just going to editorialize 2 final points before I turn it back to the moderators. One thing that I think is important is to recognize when substances become controlled, that inherently makes it potentially more dangerous for people who use drugs. So right now, when individuals who are using drugs are exposed to xylazine, it's from a diverted pharmaceutical supply. If a drug becomes scheduled, what that means is that it will become illicitly manufactured, which will lead to more contaminants and more potential adulterants added to it, so it inherently becomes unsafer for the person who may be using it illicitly. The other thing I just want to mention is it's really important when we're thinking about xylazine and talking about xylazine and its use in humans that we not contribute to or create drug panic around it. We've seen this with fentanyl and many, many other substances. And what that does is when we stigmatize the substance, such as xylazine, we are also inherently stigmatizing the people who use it. And that can lead to fear and stigmatization towards people who use substances, even more so than it already is. And it can also lead people to be afraid to intervene when, for example, somebody may be under the influence of fentanyl or xylazine because of inflated reports about its dangerousness. So thank you for listening, and I will turn it back to the moderators.
Dr. Kelly Ramsey, thank you very much for your presentation. You have been very welcome here as human doctor. This webinar is a good example of One Health, and it's very, very important to have this dialogue. I all the time defend this dialogue between what we call human doctors and veterinary doctors. Then very, very, very much appreciate your remarks and your conclusions. And then I think my job as moderator finish here. If Olatunji is recovered his communication, please, Olatunji, the floor is yours.
Okay, Rafael, I am actually very back, and I really want to thank all the three presenters, from Chen Hui Cheng to Lindsey Hornickel, and then lastly, but not the least, Kelly Ramsey, for those very, very insightful papers. Thank you for attending this lecture. I would like to say a few words about our oncoming Congress in Cape Town between the 16th and 19th of April 2024. Our beautiful theme is resilience in the face of adversity. We all know that veterinary surgeons are very resilient individuals, and we would like you to attend the 39th World Veterinary Associations Congress holding in beautiful Cape Town, and just save that date, 16th to 19th of April 2024. We will see you there. Thank you. And once again, I want to say a very big thank you to everyone who has attended this webinar. And again, as soon as we close now, you have to, there's a survey that will come on your screen as to the performance of this webinar and how it has. The assistant, Magda, Lorenko, Yvonne, I know you are hiding somewhere there, and everyone who has attended this seminar. May I say good evening, good night, good morning, or good afternoon, wherever you have joined from any part of the world. Thank you for coming.